Hi, everyone. Thank you so much for joining us tonight for our November Virtual Health and Wellness Forum. My name is Taylor Mead Patterson, and I'm the Senior Director of Health Programs for Special Olympics New York. And really happy to have you all join us tonight. Have a great presentation that I'll introduce in just a moment. But for those that aren't familiar with our virtual health and wellness forums, these are free of charge forums that we offer about every once a month. And they touch upon a couple different aspects that impact folks with intellectual disabilities. So that could be specific health issues, that could be components that caregivers encounter. And tonight is a really great addition for us, kind of building on what we consider to be someone's health and wellness, right? Just outside of those general components that we would think of health, but really just the wellness of someone's life as a whole. So two little housekeeping things before we kick off the presentation tonight. I would ask that you keep yourself muted until the end of the presentation. There will be an opportunity to ask questions, whether you are comfortable doing that on the chat or by coming off of mute. You will be more than welcome to do so. And this is being recorded. It will be uploaded onto our Special Olympics New York YouTube page and onto our website. I will be editing it to make sure that names and faces are edited out. So it is up to you if you would like to have your face on during the presentation if you ask a question, but that will be edited out in the recording. So without further ado, I'm going to introduce our presentation tonight. So as you can see from my screen, we have a presentation that touches on transitioning to adulthood. So this presentation will provide all of you with a better understanding of opportunities available to students with intellectual and developmental disabilities post-graduation, and also how professionals can use the transition process to identify and creatively implement educational goals to serve as a catalyst for students in achieving their vocational, higher educational, and personal goals and objectives. So I'd like to introduce you all to Steve Towler, who is the VP of Programs and Business Development at AHRC New York City chapter, and Michelle Shapiro, who is the director at AHRC New York City chapter in their employment and business unit. So Michelle and Steve, take it away.
Right. Thank you very much, Taylor. It's a pleasure getting to present to everybody this evening. As Taylor said, I'm Steve Towler. I'm actually the Senior Vice President for AHRC New York City. And I'm going to let Michelle say hello, and then I'm going to give you guys just a little bit of background about AHRC New York City. So, Michelle?
Hi, everyone. I'm also thrilled to be here speaking to you all today and talking about the transition process that is very comprehensive and sharing information with all of you. My focus has been in employment for over the past 30 years for people with intellectual and developmental disabilities on how to help them best prepare for, obtain, and maintain employment. And I have worked very closely with the New York City Board of Ed and different transition programs throughout my career. And I'm happy to be speaking with all of you today. So with that, I'll turn it back to Steve.
All right. So AHRC New York City is 75 years young. We actually just turned 75. And it's the first ARC in the country, actually. It was formed back 75 years ago out of the Bronx, New York, with a mom with a need with a child that had no services. And it's a long story, and we don't have that much time this evening, but it kind of started 75 years ago from one mom needing services to growing in AHRC New York City. We're part of the ARC New York. I know everyone's from around New York State. I don't know where everybody's actually from in the state, but there's basically an ARC in every single county of New York State. And if it's not one in your exact county, the one next door and the next neighboring county will provide services in that area as well. So with that said, AHRC New York City is one of the largest nonprofits in the country. We support people and their families with intellectual and developmental disabilities. We also work with at-risk youth. But our primary mission is to help people with intellectual and developmental disabilities to live quality lives in the community, to be able to accomplish all they possibly can in the world, quite honestly, right? So we have preschool programs, we have elementary school programs, we have middle schools, we have high school programs in New York City where we support students that the New York City Department of Education is unable to. So it's people that need additional levels of support and training to be successful. We're going to talk about transitioning to adulthood. So I'm going to kind of skip that part for 1 sec as people exit our schools, but we also work a lot with District 75 in New York City, the Department of Education, kind of the special education component. We offer residential services throughout New York City. We have camp and recreation programs. We have rehabilitation services, and I'll get into a little bit more of that. We have guardianship services. We have clinic services. We have services to help people in their homes, ComHab, community rehabilitation, respite programs, kind of you name it. We basically kind of provide services in every domain available out there. So this evening, we're going to really focus very heavily on transition. So I know, Taylor, I think you could maybe move a slide or two. Let's go one at a time. Right, so there we go. We did that part already. We introduced ourselves. So transition. Now, I'm not going to spend a ton of time on this, and Michelle's going to kick in some thoughts on it as well. But transition, the bottom line is the earlier you can begin transitioning from the school system to get ready for adult services, the better. The IDA requires federal law to beginning by age 14, really, where you're looking at the coordination of transition services that begin before a child exits school. And these services are, this is by no means the end of the grouping that you could be bringing in this, but you're looking at the career and rehabilitation counselors in New York State. It's Access VR, and Michelle's going to talk a little bit more about that later. Community agencies like an AHRC New York City, or let's say YAI, Young Adult Institute in New York City, right? Goodwill, goes on and on. There's different organizations, CP, Cerebral Palsy Association. So there's a variety of different ones out there that are available. Vocational assessments, work experiences, volunteering, college and adult ed, eligibility. We'll talk about eligibility in a minute. So the range of services is getting a full comprehensive group, families, educators, all in that room together, kind of working on the IEP, working on goals that are going to help that person kind of make a successful transition into the adult world, regardless of what service they're going into. So we can kind of go to the next slide, please. Why is it important, Michelle?
So as Steve kind of touched on, and actually there's a slide later on, the big difference between education and adult programs is education. Everybody is eligible for free education services right within this country, with a disability, without a disability. However, adult programs are entitlements, and you have to basically apply and prove that you are entitled to get that service, or I should say eligible for that service. So employment is an entitlement. Adult programs are eligibility based. And so that's the process is a little daunting and takes a long time. And the earlier that you start is essential, right? So the earlier that you start becoming eligible for OPWDD and Access VR makes that transition from school to the adult world much smoother. And identifying who your transition team starts in high school at the age of 14, everybody has a transition coordinator, teachers, family members, different support staff that they work with to become eligible for adult programs. So then next slide. And this is what it would look like. So, you really want to map out what you're looking for in your adult life, right? So what type of day programs? Because again, it is not an entitlement, it's eligibility. What kind of post-secondary education? Do you want to go to college or have a college experience, wellness and health, programs and opportunities, recreation, camping, right? So, do you want to have the opportunity to go to some type of day or sleepaway camp? Residential options. Where do I want to live when I grow up? And what kind of supports am I going to need to be able to live as independent as I can? And employment, which is what we focus on, what type of employment is there? How do I explore what career opportunities there are, what different pathways there are for me to get to that, and what kind of supports I will need to get there. And it could be, some people want, get some volunteer opportunities to build their resume and to explore the world of work early on. So we always like, school-based, work-based opportunities while a student is in school, kind of exploring what they would like when they age out of school. So the next. So the IEP is really the students' kind of script, their guide to what supports and what services would help them become as independent and reach what their goals are, right? So every student who has a developmental disability has an IEP and a transition team in school. This starts early, I think as early as 12 and must be done by 14. And in that plan is what type of services they need. Do they need speech? Do they need OT or PT? What kind of work-based learning opportunities? What obviously educational and academics they need. What maybe it could be how to help them learn how to travel and navigate the community independently. So everybody has an IEP that is basically their plan, their program on how to help them achieve their goals and move smoothly into the adult world. And it could also be make sure that they have, connected with OPWDD and Access VR and start that early. So those are really important to be part of the plan. So next.
Yeah, I think the one thing Michelle mentioned, and I think it's super important to be thinking about, and I don't know if folks on this presentation have children in the school system, but learning to travel, taking advantage of travel training if that's offered in the school district is really world opening opportunities for people. So individuals that can travel and can go from place to place independently, not only does it open up job opportunities because you don't need to rely on public transportation or someone to drive you someplace or Uber, kind of with that one, it just kind of opens up opportunities. If you want to go to the store, you want to meet a friend, you want to go shopping, whatever it might happen to be, independent travel is a key. And I know not everybody is able to independently travel, but where possible, it is a big plus to be able to achieve. I think next, okay.
And we kind of touched upon this, a few slides ago, but the IDEA, which is the Individuals with Disabilities Education Act, and was formally became a policy in 1990 alongside of the American Disabilities Act that we know became law in 1990. So the idea is for every student with a disability is entitled to education and to have an IEP, individualized education plan, right? However, not everybody is entitled to all those other services I said. You have to be eligible. So that is why starting this process really early is so important, because we're going to talk about some of those agencies, some of the, OPWDD and Access VR that provides those services. But in order to become eligible, there is a roadmap and there is certain applications and processes that do take time. And so the earlier that you start, the better this transition will be. And, obviously the American Disabilities Act also focuses on providing whatever reasonable accommodations the person needs. And part of that has to do with transportation, employment, right? And making sure that people with disabilities have access to all of those life, experiences that everybody else has. So next one.
All right, so
So-
this is some
Wanna go-
age ranges of suggestions for when to kind of move different things forward, right? And mentioned, Michelle, that one of the things I do related to my job is I don't know if any people are from New York City, but in New York City, and then other counties have what's called developmental disability councils, which has parents and the school professionals and agencies and funders like OPWDD and Access VR as kind of part of these. But one of the major kind of activities is really trying to make sure that the community, whatever community you're in, is kind of really doing its very best to help students make successful transitions from school to adulthood. Right. So what you're seeing here are some suggested age ranges for when different things should really be happening to kind of be ready to be best positioned for successful transition. So when you're looking at these, they're suggestions, right? And situations may dictate them. They might be a little bit different in your own circumstance or your child's circumstances. So, but I think as you're thinking about these, you want to try to make sure that things are moving forward. So, Michelle, you want to take it the rest of the way?
Sure. So go to the next one. So remember I said that the IEP process really starts at the age of 14. And one thing that this doesn't have, and this is as Steve said, is a suggested age range, but OPWDD offers persons with developmental disabilities starting that process early, not towards the end of high school, is really valuable, because while students are 14, 15, they can access services through OPWDD, such as recreational activities after school or in-home rehab services, while they're still in high school. So that's not mentioned here, but I did want to point out that the earlier that process starts, better. So that's also another thing that's not mentioned here, getting, your evaluations done, so you become eligible for the supports and the services. So as you can see, there is a team, it's a process, making sure you have all these documents available, because they are needed in terms of eligibility and applying for future services and supports. Parents being very involved and being represented obviously is really important, or whoever the caregiver is really important. So next. And Steve had touched upon, the transportation and mobility strategies, starting that travel training as young as possible, and really having that young individual kind of learn certain safety and skills needed to prepare them for traveling independently if they can, and that would help open up all those different opportunities for them. SSI and Medicaid. So that is also really important, if they qualify or are entitled to SSI benefits and Medicaid, because Medicaid actually is linked to OPWDD. So a lot of the services and support, somebody does have to be qualified for Medicaid, and most individuals who have an IEP qualify. And so to start that process early and apply for those services is very important. And if somebody is interested or guardianship and or they want to be independent, kind of exploring what they need, what supports will they need down the road. And as I brought up, kind of applying for the OPWDD. So getting that started early, and we do have a roadmap of that, and we'll talk a little bit more about it in a few minutes. And Access VR, so OPWDD basically provides opportunities for residential services, really a whole package of what that individual needs to live independently. Whatever kind of residential option, whatever kind of day program, recreational program, clinical supports. OPWD kind of, has that whole package, whereas Access VR, its whole focus is on helping individuals prepare for, obtain, maintain employment or post college and educational opportunities. So their whole focus is on employment and jobs. So next. And then, these are just additional ages and recommendations. Everybody's, registered to vote and make sure that they understand what their rights are as an American citizen. Make sure that they have health insurance, and that Medicaid obviously is very important. And we're going to talk about how to complete the transition from school to adulthood as we go forward.
Right. So a lot of federal programs are going to, you're required to make sure you've registered for selective service as well. So just to kind of keep that in mind, there are requirements here kind of with that. The vote is an optional one in a lot of ways, but there is requirements for selective service registration for federal programs with that one. So let's go to the next slide. Let's see kind of where we are with this. So post-school providers, and these are all a little bit different, right? So depending on where things are gonna kind of move. So the OPWDD system is really the most comprehensive in a lot of different ways for people with intellectual and developmental disabilities. You have to qualify for the services. Like Michelle mentioned earlier, none of these are entitlements necessarily. These are services you have to qualify for, and you have to show need. And, in Access VR's case, it's going to be showing how you can benefit in a lot of ways from the services. So finding the right service. So OPWDD, from a overall system perspective, most comprehensive, all full range of services for people, but you got to make sure you can get into those services, right? So, and it's not that easy sometimes, right? So you do have to have Medicaid. Basically, everything they offer now is Medicaid. They have what they call their front doors, which is kind of an overview of their service system. Right now, the system has what's called care coordinators, and these are CCOs, care coordinating organizations. So everybody getting into an OPWD service needs to have a care coordinator as well. So you need to go through OPWDD. You got to go through the front door. You need to determine eligibility. You need to get a care coordinator. You got to be connected to a CCO. You have to have Medicaid, right? To get all these things, you have to have had evaluations, right? So,
and I was just going to say, you have to have updated evals.
Yeah, and you got to make sure you're giving yourself enough time to get all of that done to get the eligibility that you may need. As family members and individuals receiving services and support, you have a right to go out and see different providers, right? The community providers, like an AHRC or an ARC in any county, is funded through OPW, Access VR, OMH, private grants, all kinds of things like that, right? With that one. So we need funding in order to actually provide services for people, right? So the funders are funding us. They're funding and supporting the individual, the student, the young person, the young adult, older adult, so that they can receive services that they're looking for, hopefully very person-centered and what the person's looking to do in their lives, whether it's a day program and volunteering at maybe some kind of community organization, a senior center, whatever it might be, a recreation program, going on vacation, receiving clinical services, residential services, whether it be an apartment program, all those types of things are going to need OPWDD services, right? And for support and employment, you're going to need both Access VR and OPWDD services if the person qualifies for OPWDD. For OMH services, they're not quite as broad and robust as the OPWDD services for individuals. But if that is the area of support that you need, there are a number of really good providers out there and can provide different levels of support. They're beefing up their residential system. The governor last year put a big investment in mental health and mental health residential services. So, there's improvements coming in lots of ways, and it's an expansive service. They just don't have for people with OPWDD needs, it's a little bit different. You need to kind of get eligibility. Some programs, we offer a couple of OMH programs that don't require the state approval to get in, but may require a New York City approval and be able to show the proof and documentation of the diagnosis with that one. So, Michelle, you want to take Access VR?
We're gonna talk about it in a minute,
Okay,
but why don't we go to the next slide?
Yeah.
So
go
see
for it.
that the next slide is OP.
Right, which
which-
I then kind of really gave a fair kind of overview on OPWDD, right? So diagnosis of the developmental disability for age 22. So if a person, unfortunately had a car accident and traumatic brain injury at age 24, they would not qualify for OPWDD services, be under the Department of Health. Impacts a person's life, and there are some abilities that they may have, whether it's communication, activities of daily living, being able to be independent, different things like that. There's a number of tests that get done, cognitive tests, violent social maturity tests. These things get done, and the expectation is that the disability is not going to go away in 3 weeks, right? It's not a sore back, right? It's going to continue on. There's been a tremendous increase in the number of people with autism spectrum disorder. So you're seeing more and more people with different needs in a system that is modifying kind of with that.
So go to the next one, Taylor.
And you can go to their website, and there's tons of information on OPWDD. We talked a little bit about day services. For example, AHRC has a wide range of day services all throughout the 5 boroughs of New York City, kind of being able to support people at multiple levels of their needs, 5 days a week, people being able to go in. It's day habilitation services and day services primarily these days, but there's also pre-vocational services and pathway to employment. So there's really a very, very wide range kind of in that mix. Recreation and camping, which falls under what's called respite services, so kind of connects to the same place. Guardianship services. We at AHRC New York City, we have a couple of attorneys that help people receive guardianship services, as well as now a newer one called supported decision making, which is kind of really catching on. So that's honestly, Taylor, that could be its own presentation on supported decision making. Employment services, we're going to talk more about that, making that connection to OPW and Access VR, which I mentioned you both. Residential services, these can be very, very tricky to get into these days. So you want to be working with your care coordinator. You want to make sure you're getting on the appropriate list in your county to make sure that you may not want or need services right away, but kind of getting involved and making sure you're on the proper list, because at some point, maybe you are looking for some residential supports, whether it's an apartment program, whether it's something in a higher level support. All of these things are available, but you got to make sure that you're in the system, you have a care coordinator, and you're applying at appropriate times when you may need them. So we can keep going.
Now we can go to the Access. So now we're up to Access.
There you go, Michelle. Now you can do Access.
Access, Adult Career and Continuing Educational Services. So this is our state VR. There's actually a VR in all 50 states. We are the only ones that actually call ourselves Access VR. So if you're moving to another state, there are VR vocational rehabilitation offices. And so basically their whole focus is on helping individuals find out what their job interests are, how to obtain a job, and how to maintain that job. And I always like to say it's like a big menu of services, and it's actually even grown. So now there's 3 different groups of services. One, which is brand new, for potentially eligible students. So these would be maybe the individuals who are 14, 15, 16. They're not fully deemed eligible yet. They don't have all their evaluations, or, they're working on their IEP, but the school feels that they would benefit from some career exploration, self-advocacy skills, work readiness. And so they can actually not be an open access case, but get those services with the school or a service provider, are actually now. So we are what Access VR calls AHRC is a vendor. So they will have a list of different vendors that they ask to deliver those services. So we can deliver services to potentially eligible. Then there are what they call pre-ET services, pre-employment services for basically in-school youth. And there are basically 5 different services that in-school youth, as well as potentially eligible, they basically are the same, overlap. The only difference between the potentially eligible and the in-school youth, the pre-ETs, is that they actually have a IPE, which is their plan. So different than the IEP, it's the IPE. And so potentially eligible do not have to have an IPE, but all pre-ETs individuals who are going to receive those services must have a GO plan with Access VR. The services that they offer are 1, career exploration, 2 is self-advocacy, 3, work readiness, which could be soft skills, a work-based experience, and postgraduate exploration, such as exploring whether or not they want to go to college and what that means and how to apply. So those are the 5 different services offered. Then when you get more into adult and kind of graduating out of the school system, so now these are for individuals who are out of school, 22 and up, they have different categories. So there's assessment. So those assessments could be a situational assessment at a community provider, or it could be at an actual business in the community, kind of exploring what the individual's interests are. Because sometimes they go and they say, I really want to be a dishwasher, but they're not 100% sure that they have the skills to do it. And so they do an assessment, or it can be an assessment to determine, is this person really ready for work? Then they also have different work readiness services that they offer for soft skills, again, for, different internship opportunities, self-advocacy, career exploration. So similar to what they had eligible for pre-ETs, they offer them for adults. And then they have 2 different tracks, depending on what the person's long-term support needs are. So there is job placement services for individuals who need short-term job supports on how to navigate the world of work, how to find those opportunities, understanding the interview process, obtain that job, and get a little support on getting orientated with the new job. So those individuals don't have long-term support providers. They might not be eligible for so they might not be eligible for OPWDD. They might not be eligible for OMH. So they're short-term. The bulk of the individuals we work with are eligible for what's called supported employment. And supported employment, in order to be eligible for supported employment, you have to have an extended service provider. So Access VR only provides supports once a person gets a job, for really until it used to be 90 days. Now it's a little more not clear, not as rigid. It really is what that person needs, how much intensive supports they need to be successful. And once they become more independent, it's called, we stabilize the person on the job, which means we only have to have about 2 site visits a month. And they're really able to do that job more on their own. And so then they go into what's called extended services, which is through OPWDD, OMH, or sometimes even Access VR. And we provide that extended supports because we never know what happens, right? You get a new supervisor and somebody kind of needs a little more help on how to work with their new supervisor. Maybe that employer wants that person to have a new task and that person wants to continue to advance. So that company goes out of business, 100 reasons. So to have those extended services is very valuable. So that's Access VR. So we talked about pre-employment services, which is pre-ETs, and we spoke about supported employment. And then in supported employment, there's different type of, because so supported employment provides a job coach, right? So that is one of the accommodations that we work with employers on having the individual have those supports, whether it's on the job, off the job, or both. Some jobs we customize. So Access VR provides funding for us to work with different employers on customizing jobs to really meet that person's need, because maybe they can't do that job for 35 hours a work week, but they could do that job in 20, or they can do a part of that job. They fold clothes really well, and they stock, the stock room, but they're never going to be good at the cashier, right? And sometimes retail jobs want all of those. So we customize based on what that individual would be successful in and is interested in. So I don't know if, so then we were going to go into how all of these services work with the service providers, and specifically, AHRC, and how they all connect together, leading to all the different services and supports that are offered. So next slide. And then keep one, you can go one more, Taylor.
One more.
Yeah.
All right.
So
So we talked about this as being, transition to adulthood, right? So I don't want us to only be thinking it's only employment, because that's not true. There's a really a wide array of different things that people can do in their lives post adulthood. A lot of times people go to college, right? And at one time you would say, well, people with intellectual developmental disabilities, are they really going to go to college? And now actually I can happily say we are. We actually have been very successful in New York City, working with a number of the CUNYs, one in every borough, kind of working and creating programs, college programs for people to attend 4 years and being really part of the college community. It's an interesting program model. It takes place at the colleges themselves. People don't live there or anything. They are kind of going and living back in with their families. But it's typically younger people exiting. You can stay in the Department of Education, New York City, to at least age 21. And during COVID, things changed a little bit. We had people, they changed the rules, and people were in the 22, and then they changed a little bit. They were 23, right? And now it's kind of rolling back again. But people can stay in school until they're, to get to 20 years old, 21 years old. So oftentimes then for us, the college program is, taking folks in 21 to 25, a little bit older, but mostly people in their 20s, really participating in these college programs as well. And they fall under what we call dehabilitation services, right? So OPWDD offers dehabilitation services. You have to be eligible for OPW services. You have to have all those things I talked about before. You got to have Medicaid, you got to be OPW eligible, you got to have a care coordinator, you got to have a service authorization that allows you to take that and, receive those services. But there's lots of different ways that an adult day service program can operate. They're very person-centered and they're very community-focused. One of the big things that an adult day service program will be able to provide that a lot of times, and some of the employment programs or in a lot of ours, struggle to provide, and that is transportation services. So adult day services have transportation services built into them, which means that a person that needs transport to and from a program, we can work that out. We can get that funded as part of the dehabilitation program. So we're able to do that. And for a lot of people, that's a requirement. They're not going to be able to go safely on whether it be public transportation, if available. A lot of times there's not public transportation available depending on where you live, and you may need to be able to drive from point A to point B. So transportation is provided, and the model is designed to help people really participate in the community, gain skills that hopefully are going to help them move also towards better integration of services, better social skills, doing that through volunteering, and being very, very active in the community, right? We have what's called With Walls program, people that need a little bit higher level support. And that's going to be in mostly times that'll be a certified setting that's available. But then even there, people are going out into the community. And there's also what's known as Without Walls programs. So those enable really folks to kind of really be more individualized, sometimes kind of being kind of picked up or supported from your home, apartment, residence, whatever might happen to be. So the day services, it's a very important model. It really helps people kind of stabilize, improve in different areas of health and well-being. So it's an extremely valuable program. There are pretty much day services in every county of New York State, without a doubt. And in most counties, there's multiple day programs. It is from a service perspective from OPWDD, there are roughly 40,000 individuals across the state of New York receiving dehabilitation services. Sometimes it's full-time, sometimes it's part-time. They're primarily daytime services for people. One of the big things that we're working on a lot, not only at HRC, but across OPW's collective programs and agencies, they support blended services so that people maybe are going to attend a day have program a couple of days a week, and maybe they're going to work a couple of days a week. So kind of a little bit of a mix and matching modeling. So let's go to the next slide for a sec. Clinical services. Michelle, you want to take that one?
Yeah, sure. So, you know, as I said before, in order for everybody to qualify for a lot of these services, they do have to have evaluations to determine eligibility, and they also help to determine what support needs somebody's gonna need to be independent and, you know, be successful in whatever area or focus that they have. So I recommend doing those as early as possible to get them done, and because they do take time. There is, you know, different waiting lists, and they help get you eligibility for OPWDD. Access VR, people are eligible if they have an IEP. So with Access VR, they don't need all the evaluations, all the psychologicals and psychosocials, although I think they're very valuable across the board. But with OPWDD, they are needed and mandated in order to determine eligibility.
Yeah. You're better off having them than not
Yeah,
having them, quite honestly. And then also, so our clinics operate in all 5 boroughs of New York City. Again, these are considered what's called Article 16s. So counseling, psychology, social workers, and folks like that are available to help not only with evaluations, but maybe there's some kind of crisis going in somebody's
I was
life.
just
Maybe
gonna,
there's a
yeah.
problem of sorts. So we can go to the next one, Taylor.
Next
'Cause I think
one.
we're going to run out of time, I think, a little bit. Respite services are really important services for families and individuals. For AHRC New York City, for example, respite is for us. Our recreation programs are funded under respite services. So what that basically means is the family's going to get a break. So somebody's going to come to a respite provider and receive some sort of service. And it could be, I'm going to stay with us, the out-of-home stuff, recreation, camping, things like that, a vacation. Those are respite services. We also have in-home respite services where someone may need some assistance in their home. So there's in-home services as well. That can be in the form of both respite or ComHab services. So together, they can be supportive of working with somebody. ComHab is more skill-based, kind of learning different skills. Maybe it's cooking, taking care of the apartment, things like that, self-care. Respite is really more just a real break, and oftentimes with a recreation time to focus on that one.
And Steve, in recreation, we also offer different travel and vacation opportunities.
That's very true.
Which is, you know, an opportunity to go see a place that someone's never been.
Yeah, we actually have a group that just came back from Alaska, believe it or not.
Oh.
Not these guys, actually. They looked like they were camping somewhere, right? But we had a cruise that actually 12 people went to Alaska for 10 days. So it was a fabulous vacation, one that I wish I had gone on myself, right? And respite for emergency situations as well. So we can do the next slide.
Next.
It's an important service.
So I could do the residential. So, you know, there's different options, right? Depending on what that individual's support needs are. There are there are residences for medically frail and people who need 24/7, right? Nursing care. And then there are supervised apartments for people who live more independently and just need, you know, those trainings and daily check-ins and help maybe with their budgeting, help learning how to cook meals from simple to, you know, more complex. So, you know, those are supervised apartments where they don't have somebody living with them in the apartment. I mean, you know, they might have a roommate, but the support staff might be someplace else in the building or just doing, you know, check-ins. And then there's, what we call now IRAs, which used to be like group homes. So depending on what level of support that person needs, and that is determined through OPWDD and their care coordinator. So there are different, you know, evaluations that determine what kind of level of care is needed for the individual, and different residential setting options. And the next comes to our area.
Yeah.
The-
So I think we're going to try to end on this one, right? Because it's like, it looks like it's 7:15 as we wanted to save a little bit of time for questions. And so, Michelle, we've hit a lot of this already, but I think particularly, Michelle, you want to, like, Project Search, which is a clear transition.
So go to the next one.
Yeah.
So I'm going to share. So just within our employment services, there are all these different tracks, right? So Steve brought up Project Search. Project Search is a school transition program. So it can also be an adult program, but in New York City, we have seven, because we just started 2 new ones, 7 Project Search school transition programs. Project Search is an internationally recognized program that has over 780 programs in 48 states and 11 countries. And so the search, as you can see, it's a trademark, is capitalized. So that's why it's written that way. And so it's a collaborative partnership between a host business, a school, a service provider, Access VR. And so what it looks like is, instead of the students going to a traditional high school in their last year, they actually go to school at a host business. And in New York City, our 7 host businesses, we have 4 hospitals. We have a a school. We are at a corporate building, and we're actually at 2 corporate buildings. So I'll explain. So our hospitals are Montefiore, Staten Island, Northwell Medical, Cohen Children's Medical Center, Queens Presbyterian are the 4 hospitals. Pratt Institute is our college program, and meaning college program is just where they go and train, to have internships. Restaurant Associates, that manages many corporate cafeterias, and we're at Hudson Yards. And then RXR Realty, that manages many office buildings, and we're at one of their largest, called Sarah Lee. And so what it is the students go to school at these host businesses. They have 90 minutes of education in a classroom that the business actually provides for us. And then they go into different internships. They're not interning together. They are throughout. So at a hospital, they could be at Montefiore, they're at endoscopy, central supply, dietary, environmental, the cath lab. So, a variety of different, the learning center, different types of jobs. So whether they're working, learning different areas of the food service or sterilization of equipment. And so there's 3 different rotations throughout the school year. They're connected already with a service provider, and we help them get a job upon graduation. So it's a very comprehensive and an unbelievable program that, whereas people with developmental disabilities are only 35% represented in the workforce, graduates of Project Search, and they track this data throughout the country, is over 70% of employment after graduation.
So we're very youth focused, and we work a lot on transitioning. It's a major part of our organization. So all these Project Search programs. So in New York City at the moment, it's going to benefit about 60 to 70 young people coming out of high school in District 75 right now annually. And we're looking to move that number. We're looking to get to 10, which would be roughly about 100 students kind of making their way through the Project Search system. They're not in every single county, and they're certainly not in every single school district, but they sometimes are in ones that maybe you happen to live in. So, when you have an opportunity to talk to the school staff, maybe see, do they have a Project Search program? Is that something that is available? We also have other youth services that we work with in New York City through what's known as the Department of Youth and Community Development. And these are WIOA programs funded under the Workforce Innovation and Opportunity Act. These are in every county, right? So you want to talk to, your school staff, see, do they have any WIOA programs that you can tap into? Access VR is also funded under WIOA, which is a federal legislation that brings money into every state in the country. And obviously, New York State, being a very big state, has a fair amount of money available to help support people to prepare for and obtain employment. Those are really employment-focused programs, but there are a wide array of opportunities for people to be able to do. I think we should maybe kind of just see, are there any questions that we can try to answer? Because both Michelle and I could talk about this stuff all night, but maybe there's some questions that you might have for us and we could try to answer them. So I don't know, Taylor, anybody else anyone have any questions for us?
I will open up the chat, and if anybody wants to come off mute to ask any questions, please feel free. I know we had a couple of folks that had to hop off early, but I think I speak for everybody that has joined tonight and everyone that will watch, that Steve and Michelle, this has been so wonderful to just hear all of these opportunities that maybe people don't know exist. It's like turning over a bunch of new pages to give people resources to be able to seek out for their loved ones, for the people that they support. So I've been taking notes so that I know kind of a direction on where to hopefully send some of our folks. But I'll open it up to everybody that's here. If there's any questions, please feel free to send those in the chat or come off of mute. And you're always more than welcome to reach out after the presentation, and I can absolutely forward on any questions that you have to Steve.
Yeah, we're happy to answer anything. We may come up with at a later date, or if there's more information that anyone would like, happy to be able to provide that.
You're welcome, Megan. And I'm going to put our contact too in the chat. So, please reach out if anybody has questions or thinks of questions later on, wants to be connected with any of the resources.
Yeah, even in another part of the state.
Because I do know, so when Steve said project searches throughout the state, there are 22 project search programs throughout the state.
That's great.
So, bunch up in Rochester, Westchester, Long Island, Newburgh, and we all do know each other. So,
Wonderful. Well, it looks like everyone is taking all of this great information home with them, and potentially there might be some questions that pop up. But thank you for giving us the opportunity to highlight everything that you shared tonight, and to give folks you as a place to start, even if they're not New York City residents, I think is really, really valuable. So thank you everyone that hopped on tonight, and a huge thank you to Michelle and Steve for your time and expertise and information that you've shared.
No,
it's been very valuable.
Our pleasure. So have a lovely evening, everybody.
Yeah.
Bye.
Enjoy the rest.
Be well.
Thank you. Thanks, Taylor.
Thank you.
All right. Bye.